Hi, this is Andrew Garcia, and I'll be doing my urinary catheter insertion checkoff. I'm going to begin by verifying the healthcare provider's order. Here I have Anna Pawlowski's chart, and I have the order for indwelling catheter insertion. I'm just going to introduce myself. Hi, my name is Andrew. I'm here to do your urinary catheter insertion. Do you have any questions for me? Can I have your name and date of birth, please? Anna Pawlowski. I'll check the wristband. Verify Anna Pawlowski, 5/5/1957. Do you have any allergies you know about? Penicillin. I'll check her wristband. Penicillin reaction is hives. Have you had any urethral strictures or any surgery before, or had any difficulty with urinary insertion catheters or inserting urinary catheters? If yes, I would contact the healthcare provider before proceeding. And as always, I'm going to, always do hand hygiene. I would use proper body mechanics, adhere to patient safety, so the brakes would be up, check the brakes, lower the side rail, or make sure the side rails are up, lower the bed to the lowest position, and then make sure the collar's in reach. And I'm gonna make sure to document my catheter insertion after it's done. And after that, I'm just gonna gather my equipment. I don't need the chart anymore. And now I'm gonna begin by sanitizing my hands. And now I'm gonna put on clean gloves. I'm gonna raise the bed to a working position, and I'm gonna lower the side rail. I'm just gonna maintain patient privacy. I'll close the curtain. Now I'm gonna remove the drape, exposing the perineum, and cover the upper body. So the perineum is exposed. I'd ask the patient to lie on their back. Ms. Wells, can you lie on your back and bend your knees for me? I'd have her bend her knees as so. And at this time, I would verbalize that I would clean the perineum with an appropriate hospital-approved skin cleanser, and I would examine and identify the urethral meatus. And after that's done, I'm gonna remove my gloves. And sanitize. Now I'm going to open the sterile package, and I would carefully remove it. And I would turn the plastic into a trash bag. I'm going to place it up here by the side of the patient. I'm going to sanitize my hands again. Actually, I'm going to remove the tape at the foot of the bed and I'll sanitize. Now, only touching the edges and the tips, I'm just going to open this, making sure I'm not touching anything in the drape, in the package. I'm sorry, this thing keeps flying because of my fan that's directly on it, but I just would make sure it's down, touching only the tips. And I'm touching only the shiny side. I would just pick it up and I'll let it fall naturally. And I'm just gonna pick up the corner. As you can see, I picked up the corner and I would just let it drop in between the legs. Now I'm going to open my sterile gloves. Before I open that, I'm just gonna sanitize, keeping my sterile field in vision. So I'm gonna open up the sterile gloves. And I would just boom. I'm gonna do the 2-finger scoop method to get the other glove. Just up and away from my sterile field. Now I'm just gonna adjust this using my sterile gloves. Now I'm gonna pick up this and put it over the urinary meatus. And now I'm going to open up the anti-infective, the hydrogen peroxide. I would pour it over the cotton balls, and then I would open the lubricant and put it in the tray. But I'm gonna organize it. I'm just going to leave this here and this here. And I would undo this by wrapping it around my fingers while I'm taking the sleeve off. And I would insert this in the lubricant. Here, just so you could see the tray. So it's right here in the lubricant. And I've already poured the solution on the cotton balls. I'm just going to attach this to the port. So now I would take my forceps, I would use the cotton balls to clean middle, top to bottom, dispose in the trash can, and then top to bottom on the side, and then top to bottom on the side. I used at least 3 cotton balls. So now I'm gonna take my non-dominant hand and I would open it, separating the labia. I'm gonna use this hand to insert the catheter. Oh, you can't see. So this box would be. So I'm inserting the catheter into the urinary meatus. As you can see, I'd make sure it's there's enough in, and then I'm just going to secure it with my left hand, and I would use my right hand to inject the balloon with water. And now I'm just gonna hold this and I would remove this. And I'll ensure the clamp was closed, it's already closed, and I'm just gonna hang this on the side of the bed. On a non-moving part. And I'm just going to make sure that this is taped with some slack. Let me grab my tape. I will secure it to the leg. And I would allow it to drain all the way. I'm going to, I would provide perennial care as needed and measure the urine and the, I would just record it, and I would just remove all medical equipment, like discard all medical supplies. I would dispose of it into the trash can. I'm gonna remove my gloves. And I'll perform hand hygiene. I'll make sure the patient's comfortable again and cover them up. So again, I would just document that the color of the urine, the amount, and the clarity, and the size of the catheter, and the amount of water injected into the balloon, and that would be it.